Welcome, everyone, back from the break. For those just tuning in for the first time, our scientific sessions today are entitled Confronting Urgent Threats to Human Health and Society, COVID-19 and Climate Change. I'm Jeff Balzer from Vanderbilt University Medical Center, and I'm excited to introduce the second session of the day, Climate Change and Human Health, Navigating Environmental, Societal, and Individual Impacts. We are all bearing witness to the recent confluence of extreme weather events and the manifold impact on health and society. So the time is now more than ever for the biomedical science, health, and medical communities to be intentional in addressing the nexus of climate change and human health. This session this afternoon will begin with a keynote presentation followed by remarks and a moderated discussion with expert panelists and audience Q&A. Again, we encourage everyone to ask questions utilizing the Q&A tool available under the live screen. Well, I'm honored today to introduce our keynote speaker, Sir Andrew Haines, Professor of Environmental Change and Public Health in the Center on Climate Change and Planetary Health at the London School of Hygiene and Tropical Medicine. He will be speaking on the imperative for climate action to protect health. Sir Haines was director of the London School of Hygiene and Tropical Medicine from 2001 through 2010. He was a member of the Intergovernmental Panel on Climate Change for the second and third assessment exercises and was review editor for the health chapter in the fifth assessment. He chaired the scientific advisory panel for the 2013 WHO World Health Report, 2015 Rockefeller Lancet Commission on Planetary Health, and the 2019 European Academy's Science Advisory Council Working Group on Climate Change and Health. He currently co-chairs the Inter-Academy Partnership representing 140 science academies worldwide as a working group on climate change and health, while also co-chairing the Lancet Pathfinder Commission on Health in the Zero Carbon Economy. He's published countless papers on topics such as the environmental change on health and the health co-benefits of low carbon policies. And his current research focuses on climate change mitigation, sustainable healthy food systems, and complex urban systems for sustainability. Please join me in welcoming Sir Haines.
It's a great pleasure for me to talk to you today about the burgeoning threat that climate change poses to human health, and also about the actions that we can take to reduce climate change and protect human health. Let me start with this slide, which shows you how global temperature is increasing over time. It starts in 1880, which is when the reliable direct measurements of temperature started. You can see that there are 5 different records, and they all really show us the same thing, namely that global average temperatures increased by over 1 degree or so since 1880. That those people born after 1980 have only experienced really temperatures that are above the global average for that time series. And the 5 last years are the 5 hottest years on record, and it looks like 2020 is also going to be a very hot year. This slide shows you the picture in August 2020, and it compares it with the average between 1981 and 2010. Degrees Fahrenheit. So what you can see is there's been pronounced difference between August 2020 and the average of the earlier decades. That's very pronounced, particularly over land rather than the oceans, which is what we'd expect. And you can also see it's very pronounced towards the Arctic, and which is obviously witnessing tremendous warming, and that's showing signs of that through the cryosphere. So, for example, the Greenland ice sheet has shown a record annual mass loss of over 500 gigatons, that's billion tons, in 2019. It's been declining for, as you can see, for many years, but 2019 was an extraordinary year. And the right side of this picture also gives you a visual representation of the block of 3 gigatons of ice or water compared to the Manhattan skyline. So that indicates the magnitude of these losses. So this is being driven by carbon dioxide. Particularly, it's not the only greenhouse gas, but it's a very important one. Carbon dioxide is a long-lived greenhouse gas, so it stays up in the atmosphere. 15% or more of it stays up in the atmosphere for longer than 1,000 years. You can see that the current average is it's now over 410 parts per million, and the highest previous concentration over a period of about 800,000 years was 300. So we've seen a very, very substantial increase in carbon dioxide, and that's one of the major forces driving climate change. It's not the only one. There are also highly potent short-lived climate pollutants, which are summarized in this slide. There's black carbon that comes from diesel exhaust, for example, or burning biomass for cook stoves, has local and regional effects. Methane, which stays up in the atmosphere for about 10 years, emanates from livestock, from landfills, from natural gas, from rice paddies. Tropospheric ozone, a secondary pollutant, formed from these complex interactions between these other different precursors, which has local and regional impacts and is also directly, of course, important for human health. And the hydrofluorocarbons that come from air conditioning and refrigeration. So all of these contribute to climate change. So as the temperature increases, of course, risks also increase. And this slide just gives you a graphical representation of those increasing risks. You can see that as we go above 1 degree, 1.5, and then to 2 degrees, threatened ecosystems are under greater pressures, coastal flooding increases, extreme weather events such as extreme storms, very heavy precipitation events are also increased, coral reefs are dying off. And of course, many of these impacts have implications for human health directly or indirectly, like river flooding, effects on crop yields, and most directly, of course, heat-related morbidity and mortality. And unfortunately, at the moment, it looks as though we're going to exceed, well, we certainly will exceed on current trends, 2 degrees heating by the end of the century. On the trajectory at the moment, if all the commitments made in the Paris Agreement are implemented, which is an open question, then we're heading to about 3.2 degrees centigrade, that is, increase in temperature over pre-industrial by late this century. So that is a major threat, which goes beyond really what's shown in this graph. And I think emphasizes the importance of keeping climate change to under 2 degrees and hopefully 1.5 if at all possible. So I don't have time to go into all the potential impacts of climate change on human health, but this slide summarizes some of them. And you can see that there's a whole range of exposure pathways, ranging from the most direct, like extreme weather events and heat stress, to less direct, like the effects on water quality and quantity, effects mediated through ecosystems on food supply, the effects on vector-borne diseases through distribution of disease vectors. And then very importantly, those effects mediated through socio-economic systems, the effects on physical and mental health of conflict, perhaps, forced migration, increased poverty. The World Bank, for example, suggests that unless we take positive action, definitive action, 100 million people, more people could be pushed back into poverty over the next decade or so. And so these effects are mediated through a whole range of different pathways, and they lead to a range of different health impacts. This is one example. It's the effect of increasing heat on labour productivity. And what you can see on the right side of this slide is the yellow areas are the areas of extreme heat, which gradually expand over time as the temperature increases. And you can see that the area exposed to these very extreme levels of heat during the hottest month, the summer month, that would prevent even moderate physical labour, even in the shade, really expand dramatically. And so by the time we get to about 2.5 degrees, over 1 billion people are exposed to that sort of level of heat. This is probably conservative analysis. It doesn't take into account that many people have to work out in the open, like this subsistence farmer, female subsistence farmer. And so the situation is actually substantially worse than that. And our current research is looking at the health effects of extreme heat exposures in pregnant subsistence farmers. But it's not just in low-income countries, of course. It's also high-income countries increasingly are affected by heat, have an impact, an adverse impact. And this is a recent paper by Drew Shindell and colleagues projecting forward the likely increase in heat-related deaths in the US, suggesting that with a high emission, high greenhouse gas emission future, there could be an extra 100,000 or so annually, even if you take some account of the potential for adaptation. Obviously, one can adapt to some extent, but there are limits to adaptation. That suggests that even in high-income countries, then the impacts can be very, very substantial indeed, and that's just a direct effect. But of course, heat is not distributed uniformly. There's the urban heat island phenomenon. This shows you the urban heat island effect in a very typical US city by day and by night. You can see really a lot of fluctuation between different parts of the city. And it's important to note that green space reduces the heat island. To some extent, water does as well, particularly in the daytime. So there's a lot of variation, and you can get variations in terms of degrees Fahrenheit, more than 10 degrees within the boundaries of a city, and even bigger if you compare the city with the surround. And of course, it also prevents people cooling down at night, which we know is also a risk factor for death. So disadvantaged populations more likely to be exposed to increased urban heat because they do not live in areas where there's much green space. Then there's the issue of wildfires, which has come into very sharp relief in the last few months, both in Australia and in the US and other parts of the world. We've seen a dramatic increase in wildfires. And recent evidence shows that these increased wildfire risks are due to climate change, not just due to changes in forest management in relation to climate change. The map shows you where there's been a change in the length of the fire weather season, including the west part of the US, parts of Latin America, parts of Africa, and elsewhere. And the bottom shows you the increase in acreages burnt by US wildfires, and notably that recent one in California, single fire amalgamating into over 1 million acres covered. Then we have the effects on crop yields, food crops, and the slide summarizes the likely effects of climate change on the productivity of food crops by mid-century and beyond. You can see that the red areas where there's declines in crop yield, staple crops, but also fruit and vegetables, no doubt. The green area shows you where there might be an increase in crop yield, but we don't know how long it will last for, and we don't know whether people living in low-income areas will be able to afford to buy food on the global market. And on the left, you can see that the number of undernourished people in the world has been on the rise since 2015, when it's reached its lowest point. Now it's going up, and the fear is that climate change may be contributing to that. Vector-borne diseases, just give you one example, dengue. We know that the vector mosquitoes for dengue have already increased their vectorial capacity, their ability to transmit dengue, by about 10% as a result of the climate change that's already occurred. And climate change is expected to increase the proportion of the global population exposed to dengue from about 35% to over 50% by later this century. So dengue is just one example of a vector-borne disease affected by climate change. But of course, it's not just physical ill health, it's also the mental health effects of environmental change that are of concern. There's this term solastalgia, which has been coined by our mental health colleagues, called the distress caused by environmental change. And that's been documented in people suffering from farmers who've seen their livelihood destroyed by drought. And many studies, of course, have also shown that there's an increase in common mental disorders for considerable periods after floods. There's also some evidence of the direct effects of temperature change on mental health. This is a slide by a study by Burke and colleagues, and it shows a correlation between historical temperature changes and suicide rates in the US and Mexico. So there are many pathways by which environmental change, climate change in particular, can have an effect on mental health. So let me now, in the latter part of my talk, really turn to a more optimistic picture with what that can be done about it. Of course, we can adapt to some extent. We have to adapt, but adaptation will have its limits. And we also have to mitigate climate change, reduce greenhouse gas emissions in order to reduce the risks of climate change to human health and society more broadly. So what can we do about climate change? Well, our transport systems are inefficient. They pollute. They drive carbon dioxide into the atmosphere. Our energy system as well. And our food system is a major contributor, contributing perhaps 20% of emissions, depending on where we put the boundary of the food system, but also driving biodiversity loss and pollution from nitrogen and phosphorus. So there are many policies which will both reduce greenhouse gas emissions, but also benefit human health in the near term. And it's those that I just want to emphasize in the latter part of my presentation. These are the WHO figures for the deaths linked to outdoor and household air pollution. About 7 million people die prematurely every year from both household and outdoor air pollution. Household air pollution, mainly a problem, of course, in low-income countries. Ambient or outdoor air pollution is pervasive around the world, and the great majority of us live in areas higher, of course, than the WHO standard for air pollution, and even that's probably too high. So you can see it contributes to major non-communicable diseases like heart disease, stroke, chronic obstructive pulmonary disease, but also to pneumonia, and to some extent to lung cancer as well. So a recent study that we did, published last year, looked at the specific contribution of fossil fuel burning to these premature deaths, and estimated using new disease-specific hazard ratios from over 40 cohort studies around the world, estimated that there are about 33.6 million deaths annually that could be attributed to ambient air pollution from burning fossil fuels. About 190,000 of those are in the US. So if we can decarbonize the economy rapidly, we can both prevent dangerous climate change, but also reap the benefits of reduced exposure to ambient air pollution, which causes so much ill health and premature deaths. So one of the reasons we're still burning fossil fuels, despite all the risks, of course, is that we don't pay the full economic cost of doing so. So the IMF, for example, has estimated that the energy subsidies, which they define as the gap between existing and efficient prices, which include the health and environmental costs of burning fossil fuels, are over $5 trillion a year, equivalent to about 6% of global GDP. And the health impacts, local pollution, and so on, is quite a major contributor to those costs. So obviously, if we paid the full economic cost, then that would dramatically change the balance in favor of renewable energy. I mean, renewable energy is already falling in price quickly, but it would further accelerate the uptake of renewable energy. And only about 22% of greenhouse gas emissions are actually covered by carbon pricing. In most cases, that's too low. But when we institute these changes, we need to think about the impacts on society. So if we move towards carbon pricing, that has to be carbon pricing which also supports the poor, doesn't place undue burdens on the poor. And in withdrawing subsidies, we also need to make sure that those subsidies are recompensed when they involve, for example, subsidies being given to the poor. But most subsidies actually benefited, the middle classes particularly benefit from many of these subsidies. Certainly there's a real need then to withdraw these subsidies rapidly and institute proper carbon pricing. And then the food system. This is from the Eat Lancet Commission, reported last year. And they suggested we could potentially prevent perhaps 10 to 11 million premature adult deaths a year by mid-century by instituting this kind of diet. And you can see that they advocate eating a lot more fruit and vegetables. None of us probably eat enough of those, or not many of us do. Whole grain foods, less ruminant meat, more nuts and seeds. And so this diet was in some quarters a little controversial, as it does suggest quite major changes in diet. But it, I think, does give us a very clear pathway to the future. If we combine this with reductions in food waste, more sustainable diets, then we can keep the food system within planetary boundaries and improve health. Of course, it will be important to ensure, again, that these dietary changes are affordable. So far, they're not affordable for many people in the world. And also that we need to think imaginatively of ways of changing dietary behaviours in a way which is consistent with different cultures and different dietary patterns. Cities, of course, are a major opportunity spot because many of the greenhouse gases, about 70% of greenhouse gases, are emitted from activities driven by cities. And there's a lot of work on the health improvements that can follow from increased active travel and low carbon transport. We and many others have done work in that area. This slide just is a study we did some years ago, looking at the benefits of getting the urban population of England and Wales walking and cycling, like the population of Copenhagen, which, as you probably know, has very strong active travel policies. And it shows you the costs averted to our national health system, National Health Service. You can see that these grow over a decade or two, and they're really quite substantial, amounting to about $25 billion over that period, from the reduction in diabetes, heart disease, and other conditions. Also, we know increasingly that access to green space is important for physical and mental health. It's summarized on the left side of this slide from our colleagues at IS Global in Barcelona. The dark script is where there's strong evidence, and the grey is where there's further studies are needed. But you can see there's quite an array of evidence and potential health outcomes that can be improved by access, affordable, secure access to green space. And in Barcelona also, they've undertaken this interesting experiment of what they call super blocks. So they've amalgamated city blocks. They've stopped through traffic. They've increased the growth of trees and vegetation in those blocks. And if they could scale that up to the city as a whole, then they've estimated there could be substantial benefits from reduced air pollution, improved physical activity, and improved mental health. And then finally, the healthcare system, because we have to get our own house in order. As health professionals, we're beginning to understand, thanks to the wonderful work of Healthcare Without Harm, that the healthcare system itself is a major contributor to greenhouse gas emissions. If it was a country, the global healthcare sector would be about the fifth largest emitter on the planet, about 4.5% of emissions, something of that order, about 10% in the US. The National Health Service in England has recently committed to net zero emissions by 2040 for direct emissions. The direct emissions are shown on the right side of the slide from fossil fuels, the Scope 1 emissions, the direct emissions like anesthetic gases and fossil fuels on site. The indirect emissions from electricity purchased in, and the indirect emissions from supply chains. So medical devices, business services, business travel, waste, pharmaceuticals, and so on. So in order to decarbonize the health system, you have to work not just in your own locality, but also with your suppliers to support them to decarbonize their supply chains. And the health professions are going to have a very important role in pioneering and leading some of these decarbonization initiatives. So finally, in conclusion, I think there are also very major opportunities to act on the global stage. This is just one of them. This is called the Race to Zero. It's an unprecedented alliance of businesses, over 1,000 businesses, 450 cities, many investors, regions, universities, over 500 universities, and 120 countries committed to achieving net zero carbon emissions by 2050 at the latest. In order to keep the temperature below 1.5 degrees centigrade, we will need to decarbonize 7% or more per year from now. But that means we need also to keep the global economy within this net zero boundary by 2050. So we need to act quickly, and increasingly the voice of the health professionals is going to be key in motivating other key actors to make changes. By making the case that climate change is not just a threat to the environment, it's a threat to our health and the health of future generations. But as I've indicated, there's much that can be done to reduce these risks and to improve health in the near term by rapidly decarbonizing our economy. Thank you very much.
Well, please join me in thanking Dr. Haines for his important and timely remarks. Now I would like to welcome and introduce the moderator of our panel, Dr. Richard Jackson. Dr. Jackson is Professor Emeritus at the Fielding School of Public Health at the University of California, Los Angeles, where he was Department Chair in Environmental Health Science. A pediatrician, he has served in many leadership positions within the California Health Department, including as State Health Officer. For 9 years, he was Director of the CDC's National Center for Environmental Health and received the Presidential Distinguished Service Award. He became a member of the National Academy of Medicine in 2011. Dr. Jackson was instrumental in establishing the California Birth Defects Monitoring Program and in the creation of state and national laws to reduce risks from pesticides, especially to farm workers and children. While at CDC, he established major environmental public health programs and instituted the federal effect to biomonitor chemical levels in U.S. populations. Dr. Jackson lectures and speaks on many issues, particularly those related to climate heating and on built environment and health. He's co-authored the books Urban Sprawl and Public Health, Making Healthy Places, and Designating Healthy Communities, for which he hosted a 4-hour PBS series. Please join me in welcoming Dr. Jackson.
Thank you very much, Dr. Balzer, and what a treat it is to be on this panel. And I first of all want to acknowledge the superb work by Sir Andrew Haines. He's been such an important leader. My neighbor, colleague, and friend, and 50-year member of the Institute of Medicine, National Academy of Medicine, called to my attention recently this report, the so-called ESAC report, European Science Advisory Panel. He said, this is what we need to be doing in the United States. Sir Andrew's got it. And that was one of my first deep introductions to you. So thank you very much for that background. I have lived in California off and on for about 40 years, went to medical school here, and we're kind of used to having fire smoke. You go up to the Sierra in the summertime, and there's usually some smoke in the air. But September in the San Francisco Bay Area was surreal. On September 9th, I wondered if I had awakened on Mars. You've seen the pictures. The density of red smoke overhead was shocking. And folks with rooftop solar panels found them generating close to no electricity whatsoever. My wife Joan and I were concerned that PG&E, our utility, was going to turn off the electric power because of fire concerns nearby. And so we checked the go bags. It's not something I consider progress that we now keep go bags, we all do around here, by the front door with legal documents, hard drive backups, cell phone chargers, medicines phone list, police whistles. I'm beginning to think I need to put bear spray in there, face masks, and family photos. We checked the websites, including the ones from, Jane Lubchenco knows this well, NOAA, NASA, EPA, and California. And we called our son, who's a teacher in nearby Walnut Creek, to see how he and his family were doing, especially 1-month-old granddaughter Olivia, people that are most at risk from this. And I was annoyed with myself because I had been waffling for the last couple of months about whether to buy a good quality indoor air cleaner. And of course, the day it became clear to me, there was none left for sale. And by the way, a good solution solves multiple benefits because it would be useful for viruses in the air as well. And I thought I knew better. But once again, climate surprised me, as it does all of us with the rapidity of the onset. Jeff mentioned that I had worked for CDC for 9 years, one round at CDC, as head of the National Center for Environmental Health. I went there in 94. And in 1995, we got a call from Chicago about a sudden increase, relatively sudden increase in deaths. And we sent an EIS officer, Jan Semenza, to Chicago and mentioned that it was unnerving to see freezer trucks pushed up against the city morgue. Jan documented over 700 deaths and the lessons that we would learn now around the world continually. Hot nights killed people, especially if you had a sequence of hot nights. Sealed windows. And people sealed windows because they were afraid of crime or other issues. And buildings that were built for winter but never were really intended to be heat ready. And a public health system that was unprepared. Also at the National Center for Environmental Health was emergency response. We were activated on September 11th, of course. But we had the Refugee Health Group, and I learned so much from those folks about desperate events when huge populations begin to move. There's severe hunger, many infections, but what I didn't know until then was the degree of violence, rape, and other harms that occur when large populations move. In that job, I had to go to Washington, D.C., probably about once a week, often in the White House, and became friends with Robert Watson, who was the head of the Office of Science and Technology Policy. And he said, well, you think you know environmental health, but you don't really understand climate heating. And he educated me over the next few months to the point that I swore I would never give another public health lecture without talking about climate change. But then I quickly learned that I did not get a welcome when I talked about this in the so-called red states. So over the next few years, I learned from a lot of friends of the Academy, including newly admitted member Jonathan Patz, from my neighbor Kirk Smith, who sadly passed away. And Kirk had done so much work in developing countries, particularly for indoor air pollution and biomass fires, but also from old friends Lynn Goldman, Frank Loy, who was the chair of the Environmental Health Roundtable for the Academy, Howard Frumkin, and Jonathan Fielding. And we held in 2007 the first NAM meeting, Roundtable on Environmental Health, focused on climate change. And we were joined by a Nobel Prize recipient who had shown huge bravery in trying to fix the ozone layer from CFC threats. And that person, of course, was the very brave and admirable Nobel Prize recipient, Dr. Mario Molina, who passed away about 2 weeks ago. So we have come a long way, but I have to tell you how delighted I am with this meeting and the fact that this panel of really marvelous individuals will be talking about these issues. So I'd like to introduce the Honorable Jane Lubchenco, and she's the University Distinguished Professor at Oregon State University. World-renowned environmental scientist, deep experience in science, academia, and government, and a champion for the stronger engagement of scientists with society. From 2009 to 2013, she served as Undersecretary of Commerce for Oceans and Atmosphere and administrator for NOAA, the National Oceanic and Atmospheric Administration. She was nominated by President Obama in 2008 as part of his Science Dream Team, and she's a marine ecologist and environmental scientist by training, with expertise in oceans, climate, and interactions between the environment and human well-being. In fact, when Senator Ron Wyden introduced her to his Senate colleagues, he said, "This is the bionic woman of good science." Jane received her bachelor's from Colorado College, a master's from the University of Washington, and her doctorate in ecology from Harvard, where she worked for a couple of years as a professor there, and then continued on to Oregon State University for 32 years until she became NOAA administrator. She then moved on for a while at Stanford and then accepted the offer to return to Oregon State as the University Distinguished Professor. So with that, we are honored to have the Honorable Jane Lubchenco.
Thank you so much, Dr. Jackson. This is a wonderful occasion, and I'm delighted to be here with you today. We just heard from our keynote speaker about the myriad strong connections between climate change and human health. I'd like to amplify that message with a deeper dive into the links between ocean, climate, and health, including a spotlight on new opportunities to reduce climate impacts with ocean-based action. Next slide, please. In the following few slides, I wish to emphasize 3 key points. 1, the ocean, climate change, and human health are closely intertwined. 2, we have tools to reduce greenhouse gas emissions much faster than we are doing now. And 3, if more people understood the health benefits of addressing climate change, we could make more progress faster. Next slide. Last year, the IPCC highlighted both the inescapable importance of the ocean in the climate system and the devastating impact that climate change is having on ocean ecosystems. These impacts have direct consequences for human health. Next slide. It boggles the mind, but even our massive ocean has been dramatically altered by climate change. Excess greenhouse gases in the atmosphere have changed the very physical and chemical properties of the ocean. The ocean is now warmer, and in some places much warmer, characterized by intense heat waves that devastate fisheries and trigger toxic algal blooms that in turn pose health hazards for people and for wildlife. Warmer water holds less oxygen, with hypoxic zones increasing around the world, also affecting fisheries and food security. Global sea level is rising, which erodes coastlines and floods coastal communities, destroying crops, contaminating drinking water, and triggering disease outbreaks. The ocean is now 30 times more acidic than it was at the beginning of the 19th century. Changes in ocean chemistry make it harder for marine life to make shells and skeletons of calcium carbonate, and this in turn affects the delivery of nutritious seafood to the billions of people who rely on seafood for their primary source of protein. Climate change is also making ocean ecosystems less resilient and less predictable. Next slide, please. The ocean is the engine for global weather systems. Some of the ocean perturbations I just mentioned eventually play out over land, with direct consequences for the safety, health, and well-being of millions of people on the coast, but far inland as well. This image shows the now $16 billion weather and climate-caused disasters in the continental U.S. for 2020 so far. Not all of these are directly connected to the ocean, but some certainly are. Let's focus on hurricanes, whose connection to a warmer ocean is obvious. Next slide. The number of hurricanes spawned in the Atlantic and the Caribbean varies from year to year, depending on the water temperature, the air temperature, and wind shear in the upper atmosphere. There is unequivocal evidence that climate change is affecting hurricanes. Note, there is no evidence that climate change affects the number of hurricanes each year, but it does indeed affect the intensity of hurricanes, how fast they move, and how much water they hold. These climate-related impacts in turn affect the intensity of storm surge, coastal and inland flooding, tornadoes spawned by hurricanes, and of course the destructive impact of more powerful winds. Next slide. These perturbations have direct impacts on people, our health, our communities, our economy, and social justice. Storm surge alone was responsible for over half of the 2,500 deaths in the U.S. due to hurricanes between 1963 and 2012. However, the news from the ocean is not all bad. It's not all doom and gloom. Next slide. While there is no doubt that climate change is having devastating impacts on the ocean and ocean ecosystems we depend upon, recent scientific findings have revealed that the ocean is also a powerful source of options to mitigate climate change. A new scientific analysis that I helped organize and commissioned by the high-level panel for a sustainable ocean economy provides some startling and timely information. Next slide. The report provided the first ever quantification of the magnitude of greenhouse gas emissions that might be possible from a range of coastal and ocean-based activities. The analysis focused on 5 possible promising options. 1, sources of clean, renewable energy. 2, options to reduce carbon emissions from the massive shipping enterprise that carries over 90% of world trade. 3, tapping natural carbon sequestering habitats such as mangroves, salt marshes, and seagrass beds, the so-called blue carbon ecosystems. 4, encouraging people to eat less animal protein from the land and more seafood. And 5, storing excess carbon in the seabed. Next slide. Much to everyone's surprise, adding these 5 options together resulted in the potential to achieve 1/5, 21%, 1/5 of the total emission reductions needed to get to the world to the 1.5 degree target by 2050. That's huge, 1/5 of what we need. And it wasn't even on the radar screen of most folks thinking about mitigation. We're land-based creatures, so most of our focus has been on what's close at hand. Energy production on land, food systems, transportation, buildings, forests, etc. Moreover, the assessment suggests that the first 4 of these items across the bottom of this figure, ocean renewables, decarbonizing shipping, blue carbon, and shifting diets, are ready to deploy. Not necessarily easy to achieve, but ready to deploy. The 5th, carbon storage in the seabed, still has a lot of technical and environmental questions. Nonetheless, the message is clear. We have more and powerful tools in our carbon mitigation toolbox than has been appreciated. I think that's good news. Next slide. The report concluded that ocean-based mitigation options also have multiple co-benefits. Cleaner energy means less air pollution with all the attendant health benefits. Decarbonizing shipping means less air and water pollution in port cities. Protecting and restoring mangroves, salt marshes, and seagrass beds helps restore nursery areas for fisheries, provides buffers against storm surge, and creates wildlife and recreational habitat. Shifting diets, as recommended by the Eat Lancet reports, has significant health benefits. These co-benefits combine with the mitigation benefits to reinforce a new narrative of the ocean as a source of solutions. Next slide. In short, new scientific findings are revealing the intimate connection between the ocean, climate change, and human health. Not surprisingly, most people are unaware of these connections. The better they are known, the sooner we can tap this potential. Next slide. And so I'll close with my key points. One, there is a powerful link between the ocean, climate change, and human health. Two, options exist to reduce greenhouse gas emissions much faster than is happening now. And three, if more people understood the health benefits of addressing climate change, we could do much more effectively. We could do that much more effectively. All of you have a key role to play in making that happen. Thanks, and I look forward to your questions during the Q&A.
Dr. Lubchenco, thank you so much. And at this point, I would like to introduce Jacqueline Patterson. Jacqueline is the Senior Director for the NAACP Environmental and Climate Justice Program. Since 2007, she served as coordinator and co-founder of Women of Color United. Jackie Patterson has worked as a researcher, program manager, coordinator, advocate, and activist focused on women's rights, HIV/AIDS, racial justice, economic justice, and of course, environmental and climate justice. Ms. Patterson served as Senior Women's Rights Policy Analyst for ActionAid, where she integrated a women's right lens for the issues of food rights, macroeconomics, and climate change, as well as the intersection of violence against women and HIV/AIDS. Previously, she served as Assistant Vice President of HIV/AIDS programs for the IMA World Health, providing management and technical assistance to medical facilities and programs in 23 countries in Africa and the Caribbean. Ms. Patterson served as the Outreach Project Associate for the Center for Budget and Policy Priorities and research coordinator for the Johns Hopkins University. She's also served as a U.S. Peace Corps volunteer in Jamaica and holds a master's degree in social work from the University of Maryland and another master's degree in public health from Johns Hopkins. She currently serves on the steering committee of Interfaith Moral Action on Climate and the advisory board for Center of Earth Ethics, as well as the boards of directors of the Institute of the Black World, the Hive, Gender and Climate Justice Fund, and the American Society of Adaptation Professionals, Greenpeace, the Bill Anderson Fund, and People's Solar Energy Fund, as well as the National Black Workers Center Project. Jacqueline Patterson, welcome. Pleasure to have you here.
Thank you so much. It's so good to be here. I appreciate you. So yeah, I just wanted to talk a little bit about the intersections that we find ourselves experiencing as it relates to climate change and health, and particularly myriad other issues that are inextricably connected to at this intersection. So we know that there are inequities that exist across the climate continuum, from the drivers of climate change to the impacts of climate change. And there's differential impacts on certain communities and certain populations. So whether it's the disproportionate exposure to pollution, to the differential impacts of shifts in agricultural yields, extreme weather, and sea level rise, we see how who you are, where you live, and your circumstances are such a big indicator of the health and other impacts that you'll face. So when we talk about intersecting impacts for at-risk populations, it's everything from the fact that as the NAACP, we work on racial justice issues and have found, certainly through our work with whether it's the Fumes Across the Fence Line report or our Cold-Blooded report, that we, and building on the academic work of folks like Dr. Bob Bullard and Dr. Manuel Pastor and others who have done work around the the intersection of race and where one lives and the exposure to toxicity, we have found that whether it's the kids who are more likely to live next to coal-fired power plants, in our cold-blooded report, we found that African-American families were 68% of African-Americans live within 30 miles of a coal-fired power plant. In our Fumes Across the Fence Line report, we found that a large proportion of the oil and gas refineries and facilities are located in African-American communities as well as Latino communities. And we see how this plays out in terms of health impacts. We know that African-American children are 3 to 5 times more likely to enter the hospital because of an asthma attack and 2 to 3 times more likely to die of an asthma attack. We know that the other co-pollutants that come out of these smokestacks, in addition to the toxins that drive climate change or the greenhouse gas emissions, we have sulfur dioxide, nitrogen oxide, mercury, arsenic, lead, and these are tied to everything from exacerbating asthma and to COPD, and we have a situation where there's more of a prevalence of COPD in our communities. We also know that even though we're less likely to smoke as African Americans, we're more likely to experience lung disease. And then when we think about the toxins that come out of smokestacks, including mercury, that also impacts birth outcomes. And we also know that African American women and families are more likely to experience infant mortality, low birth weight, and other challenging birth outcomes. We also know that lead and manganese also impact learning ability, whether it's the tie between lead and attention deficit disorder or otherwise. So if you're a child who is having a hard time paying attention in school, having a hard time even going to school on poor air quality days, if you're home from asthma, then all of these impact one's educational attainment. And studies show that if you're not on grade level by the 3rd grade, you're more likely to enter into the school to prison pipeline. We also know the past work around toxic waste and race, that we're more likely to live next to, whether it's the landfills or the incinerators, both of which they generate a lot of methane, which is one of the other greenhouse gas emissions that drive climate change, and the other co-toxins also impact the health and well-being of our communities. When we look at pipelines and other aspects of the energy sector, then whether it's the gender justice issues of the missing and murdered Indigenous women along the pipeline routes, or even the man camps, the places where men gather to work the rigs on the oil and gas industries. We've seen this proliferation of missing and murdered women, of trafficking, of drug trade, and so forth, and Indigenous women pay the price. We talked about urban heat islands, and we know that, again, compromised birth outcomes are tied to urban heat islands and exposure to extreme heat. We talked about Chicago earlier. With the heat wave that happened in 1995 in Chicago, there's a recent movie release called Cook that really talked about the race lines along which who actually suffered and who was more likely to die as a result of that extreme heat wave. We also know that that on the other side of the continuum, in terms of the impacts, whether sea level rise is already displacing and fracturing families and communities, separating Indigenous folks from cultural traditions that are often tied to land and water, and other communities who have grown up in generations in these areas, such as the Biloxi, Chittimaca, Choctaw band that were displaced in southern Louisiana due to the combination of sea level rise and the land sinking. We also know that people are being driven from their lands in other nations. The U.S. is 4% of the global population, yet 25% of the emissions that drive climate change. And so, but yet we have these punitive immigration policies when people are just trying to seek refuge and survival. We also know that water scarcity is one of the challenges that we're seeing as an impact of climate change. I was just in a community called Sand Branch, Texas, which is a former freedmen settlement, Black community in right outside of Dallas that hasn't had running water ever. And now it's even now they're being even more threatened as we fight water scarcity in the context of climate change. So the examples are so many. We mentioned the California wildfires, and we know that already our communities are more likely to have asthma and have compromised compromised respiratory systems. And then when you couple the heat, the wildfires on top of it all, it's our communities that are suffering. When I was watching the news about people trying to manage the disasters, they were talking the disaster of the California wildfires. They referred to prisoners as resources that aren't available because of the early releases. But again, in that situation, the way prisoners have been used to fight those fires, it's another yet another circumstance of which we're seeing in COVID-19 of essential work, but disposable workers in terms of how they're being treated and facing inhumanity in those situations. So as I kind of wrap up my 7 minutes, I'll just say that with the U.S. history stemming from manifest destiny and a trail of tears to slavery to racism and behind, we have an economy, a political system, and a culture that's predicated on there being winners and losers. Even though we have an ecosystem that is divinely designed based on principles and practices of regeneration and cooperation, from the cooperative systems of ant and bee colonies to the fact that seeds have an infinite capacity for regeneration, to the fact that the sun rises every day like clockwork, bringing new opportunities for energy around the globe. Yet we as a U.S. society continue to operate against the very laws of nature. So we have to transform from a political economy that favors profits over people and corporations over communities to one that shifts from extraction, exploitation, and oppression to one that is rooted in regeneration, cooperation, and deep democracy, using policies like campaign finance reform, reversing Citizens United, building strong local economies, making sure that there's universal access to the commons. And we can do all of this in harmony with our planet, without pollution, and with uplifting the human rights and dignity as well as earth rights. Thank you. I look forward to the conversation.
Thank you so much, Jacqueline. And I hope that much of what you just said is in the next State of the Union address, but I won't go any farther than that. People know what I mean. The next person I would like to introduce is my old dear friend, Dr. Georges Benjamin. And George is a well-known health policy leader, practitioner, administrator, and he serves now as, actually for quite a long time, as executive director of the American Public Health Association. It's the largest, oldest public health group in the United States. He was Secretary of Health for the state of Maryland and Georges, graduated Illinois Institute of Technology and the University of Illinois College of Medicine. Georges is boarded in internal medicine and a master in the American College of Physicians and a fellow of the National Academy of Public Administration and a fellow emeritus of the American College of Emergency Physicians. And he is a fellow member of the National Academy of Medicine. He serves on several nonprofit boards, Research America, the Truth Foundation, the Reagan-Udall Foundation. And he's a member of the National Infrastructure Advisory Council, a council that advises the president on how best to assure the security of the nation's critical infrastructure. Amazingly tied to climate in so many ways. And I have to tell you, Georges is one of my heroes. And it's such an honor to have you here, Georges.
Dick Gazilson, thank you very, very much. And Jackie, let me just thank you very much for your advocacy on behalf of the people of America and the underserved populations. Your work is just so extraordinarily important. And Jane, your work obviously on the oceans is important as well. And my good friend, Sir Andrew Haines, as well, who really set the stage in a very critical way for us. I'm going to talk very briefly about the health impacts. And I like pictures. Those of you know I like political cartoons and I like pictures. So if you go to the next slide, just remind us that 2020 has been a very, very turbulent year for the whole world. But also I'm going to focus certainly a lot on the United States. And I often get asked by my colleagues in medicine and public health, why should we be concerned about climate change? Isn't this something that the tree huggers and the polar bear lovers and the folks that care about the green environment care about? And I retort that if it hurts people, it kills people, it's ours. And so let me try to make that case for you very, very briefly. If you go to the next slide. So Laura talked about the numerous named storms that we had. Hurricane Laura was was obviously a very big one that we had back in August. But we now, of course, have had 10 named storms. I think the last time we had this many named storms was, I think, in 1916. And for those of our friends and neighbors who have been in Louisiana, they've had certainly 4 of them this very season. Storms, of course, not only cause injury and death. We had about 4 of these deaths with Hurricane Laura, but drownings and injuries, and then the long tail of molds and just unacceptable living conditions that occur. And of course, many of our communities recover very, very slowly from that, particularly those low-income communities that occur from this event. Next slide. And Dick talked about the Western wildfires. Obviously, this whole issue around extreme heat and drought remains a major issue. I think at last count, we had almost 40 deaths from the wildfires. And I think the real challenge here, of course, is that you get not only the death and concerns from these fires and the loss of enormous amount of green space and an infrastructure, people's homes. But these wildfires create an environmental catastrophe for our nation as well. So if you go to that next slide, Dick pointed out the fact that we certainly from the wildfires had significant air pollution. And just let me point out that the air pollution that from these fires was substantial. And it not only resulted in bad air for weeks and maybe months, but there's some studies that have shown that the lung effects have persisted in our neighborhoods for years. And in addition to that, I remember that many of the people that in San Francisco, I was actually on a webinar talking to folks in San Francisco, and they talked about the orange hue that persisted in the city for quite some time. You couple that fact with we still have the tragedy of our coal burning power plants and still too many cars on the road that have resulted in significant perpetuation of air pollution. Next slide. And then, of course, we got hit with SARS-CoV-2. Obviously, this is a double emergency in our nation. And while we're focused like a laser on trying to mitigate the impact of SARS-CoV-2 using all of the various science tools that we had, you heard a very eloquent presentation around SARS-CoV-2 and COVID-19 in the previous panel before this. But let me just point out that there's an important intersection between SARS and climate change that we have to acknowledge. And if you go to the next slide, let me just acknowledge my good friend Jonathan Patz for allowing me to utilize this slide that he had. And just to point out that we have significant air pollution that remains in our nation, and that there is some early evidence that there's a correlation between air pollution and an increased risk of dying from COVID-19. Now, I want to remind you that correlation is not causation, and we still need to have a lot more studies to prove that. But I think the point is that we know very clearly that people who have asthma, chronic lung disease, and a range of other chronic conditions do have an increased morbidity and mortality if they get infected with SARS-CoV-2. And this is a significantly important issue because these two critical intersections between these two very, very serious epidemics that we're having right now, as we speak, remind us of the importance of using science and having a science-based approach to addressing these very, very significant problems, and that we have to think of our approach to science and public health in a much more coordinated and collaborative way. That means we have to bring together not only the doctors and nurses, but we have to bring together the environmental scientists and the engineers if we're going to be serious about solving these very significant problems. Next slide. Now, as we think about the fact that we have rising carbon dioxide levels, we know that our nation, the temperature is rising, as we saw Sir Andrew Haines point out. We have the rise in sea levels that Jane pointed out. And this more extreme weather is resulting in a whole range of changes from a public health perspective. I talked about the severe weather and the air pollution, but we also have these changes in vector ecology, many more allergens in the air, significant changes in our water quality, not only just from climate change, but from these severe weathers, because we have more flooding, contamination of our current drinking water for those communities that have drinking water, and significant drought conditions, which are significantly impacting communities. You heard Jackie talk a bit about the fact that we have many communities that just don't have safe water, even to wash their hands. And of course, in the middle of a pandemic, that's a significant problem. And then you heard Dick talk about this whole issue of forced migration and civil conflict. And of course, the mental health impacts that Sir Haines talked about are significant. And if you take the fact that all of these things together collectively have significant impacts on the health and well-being of our population, we've got to think about how the public health community is going to address this in a much more functional way across our systems. Next slide. So this is fairly much hot off the press, the 10 essential public health services. I just remind you that the look of the 10 essential public health services has changed, but the work has not. We still have our still core functions of assessment, where we actually think about what's going on in the community, policy development, where we develop policy-based solutions, generally way upstream to try to address some of these problems, and assurance, where we provide the accountability for public health. Public health is very much in the center of doing this. And if you'll notice in the new 10 essential public health services, we have put equity in the center of everything that public health does. So as we think about how we're going to address this in a very structured way, we need to now build our public health systems in ways that we can get ahead of both these outbreaks like we have, these dual outbreaks of infectious diseases, and more aggressively addressing climate change. The Center for Disease Control and Prevention has worked collaboratively with groups of their partners to come up with a framework called the BRACE framework, which is building resilience against climate effects in health. And if you can see here that it points out the importance of both forecasting climate impacts and assessing our vulnerabilities. Number two, to project, so we can project the disease burden that's going to occur. And we need to get better tools for us to really try to project that disease burden. Assessing effective public health interventions, and developing and implementing climate and health adaptation plans. Adaptation is going to be a very, very important part of what public health does here. And then, of course, we always like to evaluate what we do, evaluate the impact, and improve these interventions over time are going to be very important. Public health continues to play a very important role. And then if you add to that the health sector's role, recognizing that the health sector is 10% of our production of carbon dioxide, and we're a major contributor to greenhouse gases. We've got to do something about that as well, so that we have a role not only on the adaptation side of the house, but we also have a role on the mitigation side. And if we can all begin aggressively reducing our carbon footprint, then I think in many ways we can begin to tackle this problem, and we don't have time to waste. With that, I think my next slide is my last slide. And that I want to thank you, and I will turn it back over to the good Dr. Jackson. Dick, it's all yours.
Thank you, Georges, and thank you all. I'm going to moderate the discussion until for about 15, 20 minutes, and then we'll go through questions from the audience, and from the folks attending can put them in. I will maybe put some questions forward in the sequence that you spoke. Jane, when I was a young man, I worked on smallpox eradication in Bihar State in India, and remember seeing the Ganges River for the first time, and the fact that it was miles across, it's flat, the Gangetic Plain. But where I'm going with that is the summers were brutally tough even then, but what's going to happen as the Himalayan ice sheets begin to disappear and the Ganges dries up along with the Brahmaputra? And by the way, it's very low-lying, both West Bengal, where Calcutta is, and Bangladesh, and the staple there for many of the areas is rice. And saltwater overflow with one of the cyclones would be a major threat. What thoughts have you given to that, Jane? I'm sure you have given a lot of thought to it because it's an absolute public health issue.
Yeah, Dick, you went right to the heart of it. There are some major, major challenges, and the confluence of the human-induced climate change impacts on some of the poorest people in the world is just so intense. So we're seeing changing patterns of precipitation, both, raining different times of the year, the monsoons are changing, and raining different places from before, so it's less predictable. And especially for people that are right on the margins, that can really bode, it can be very, very problematic. On top of that, you're right to focus on the way the water in the planet is stored, because much of the rain that comes, that irrigates crops, comes from, in some places of the world, water that is stored in the mountains. That's true from the Himalayas. It's also true in my state of Oregon. And we are seeing less precipitation as snow and more as rain. We're seeing it earlier in the season, and that has huge ramifications for farmers everywhere. But it's especially problematic for those on the margins that just don't have the other kinds of options or the access to information or weather forecasting that we do. You couple that with the sea level rise and water intrusion into these low-lying areas, and the crops that are the sustenance of many of these people are seriously compromised. So this is a public health crisis without any doubt. Just this one issue of food security, whether it's food security from crops on land or food security from the ocean, because those same changes are happening in the ocean. And the 3 billion people that depend on seafood for their primary source of protein are seeing the fish move to colder waters, to deeper waters. And so we see the same thing playing out on land and in the ocean. And food security is a serious challenge. So mitigation first, but adaptation, both have to be given equal weight, and both are urgent.
And I'll ask Sir Andrew to reflect on that as former head of the London School, including of hygiene, maybe supplement that. Sir Andrew, can you unmute? Go ahead.
Yeah, sure. I mean, obviously, as we've heard, the twin challenges are adapt and mitigate. And those two communities often work separately and don't work together. And one of the challenges, I think, is to integrate adaptation and mitigation more closely. So
that sounds vague. So tell us. Sorry,
yeah,
go ahead.
Some adaptation options, for example, air conditioning, it sounds very attractive. But the problem with air conditioning, of course, is it uses a lot of energy, and that usually means burning fossil fuels. Also, it means that we increase the urban heat island effect, because you've got to pump the heat somewhere. So you pump it out into the open air, and that increases the urban heat island. So increasingly, we need to integrate these two types of approaches. And there are various approaches to adaptation. I mean, one of course, is just strengthening, making more resilient health systems, early warning systems for heat waves, for disease outbreaks, and so on. But for many parts of the world, the crucial factor is actually having a health system at all. Because it doesn't matter how good your early warning systems are, if you don't have a functioning healthcare system, then you won't be able to adapt properly. So the third sustainable development goal, which is universal health coverage, is a crucial aspect of adaptation to climate change. We need to integrate those two solutions. As you said, certain parts of the world are very, very vulnerable indeed. Not just the Himalayas, which is one area, but also, for example, small island states. With sea level rise, many of them depend on a thin lens of fresh water. And once that fresh water is no longer available, then those communities become non-viable. And the Arctic as well. We're seeing populations being displaced by melting ice. So many parts of the world are very, very vulnerable indeed. And although we need to adapt, I think a crucial priority is to mitigate, to cut emissions very rapidly, to try and reduce the rate of climate change.
This series that we're just talking about, where the folks in the polar regions probably did the least to contribute to the level of carbon of the atmosphere, the folks, very poor people in West Bengal and Bangladesh, did very little to contribute to this, and yet they're the ones that are reaping the greatest harms from this. Jackie or Georges, would you want to comment on this? I think, Jackie, I'll ask you to go first, if you don't mind.
Actually, it would be great if Georges goes first.
Okay, sorry. No, it's okay.
Thank you.
Thank you. You know, and I think that the challenge, of course, is that if you have a small farm, you know, the impact on your property, the impact on your ability to feed your family is enormous. And I think that's what we see in those communities outside the United States. But we also have to recognize that in those communities inside the United States, you know, we still have people in the Houston area that still have blue tarps on their houses, not from this storm this year, but from storms last year.
From Harvey.
And so the challenge we have is, and our structure, you know, many of those folks could not afford flood insurance. So their ability to even begin to recover is dramatically impacted. And I think that's the problem. And we can fix that. You know, that's not something that we can't fix. We can fix an insurance structure. We can subsidize those things. We can decide not to build in certain places. As you know, one of the communities that was flooded was intentionally flooded in order to avoid another catastrophe. So we can do some things by much smarter land use.
Yeah, and just to weigh in there.
Go ahead, Jackie.
Yeah, just in terms of we talked before about multi-solving and doing interventions that are both adaptation and mitigation, and the rethinking our food systems is one of those ways. I mean, we have now a system where people are trucking kiwi across, or, you know, shipping and trucking foods. And if we actually had more in the way of local food movements, then we could not only reduce the shipping and trucking of foods, but we also are producing foods that where there's more access for communities, as we talked about before, in terms of the history of redlining that has separated certain communities from healthy and nutritious foods, where they're more likely to get their food from a corner store or even a gas station than to get food from a farmer's market, much less, or a grocery store. So we need to be thinking about ways that people have access to healthy and nutritious foods as shifts in agricultural yields happen. And we have to think about ways that we reduce the goods movement that contributes to the greenhouse gas emissions that drive climate change.
Let me stay with that for a bit. I think something like 45% of all the air pollution in South LA up from the port of Los Angeles, and by the way, about 40% of all the imports to the United States comes through that port, and it goes right through the poorest neighborhoods, Long Beach and Los Angeles and up that river. And these are folks with often a lot of underlying health issues, including asthma. And as you mentioned, the average difference in birth weight in the most polluted areas and adjusting for socioeconomic status is about 6 ounces and attributed to air pollution in those areas. So people have really borne, there have been some improvements with electric switching engines and cranes and that sort of thing. But even rich place like Santa Barbara, 40% of the air pollution's from the ships going up and down the coast. So there's a lot, Jane Lubchenco, you need to work on, because the transport of materials is a huge issue. And I am, in my career, have found like the railroads to be some of the most miserable people to work with. I don't know if the shipping industry is any better. We regulated, when I was at CDC, the cruise ship industry, and they were always scared of people not showing up. So they were easier. You want to comment?
Sure. This is a very a wonderful opportunity, if you will. It's not easy, but there is an increasing, very rich, robust conversations, and more of the shippers are coming on board with appreciating the need to address climate change and the opportunities for decarbonizing shipping. And there is now a coalition of shippers that are talking actively about using renewable energy for shipping. There's some very exciting things happening in a few countries that are leading the way. Norway, for example, has been Norway has a lot of islands and has a lot of ferries going back and forth from island to island. And they have some very progressive companies that are in the process of converting all of their ferries to electric ferries, essentially. And that model could easily be adapted for national shipping. International shipping is probably a different set of solutions, but there is a lot of action on this front now, and I think we're going to see some very remarkable opportunities in the not too distant future. This is an area where I think there's huge bang for the buck, and it's possible to do it.
My colleague at UCLA, Michael Jarrett, has just completed a study in conjunction with Physicians for Social Responsibility in LA, and he looked at the very poorest neighborhoods and, number one, the green coverage, that is parks, and having fewer parks is a risk to your economics because your equity doesn't increase because of that, but it also is a risk to your health. And there was a report it was an article in the New York Times Sunday magazine about 6 weeks ago, and these were journalists. They were not epidemiologists, but they looked at the red line maps in Richmond from 3 generations ago, and the fact that redlining had left behind persistent poverty, no increase in equity, because for a lot of reasons which others can describe better than I. But what was striking to me is even the green coverage, the fact that there was no investment in trees, arborization in those areas, meant that these areas were 5, 6, 7 degrees hotter through the summer. And heat is bad for your health. It's not simply, collapse from heat stroke. It generates much more more conversion to ozone and other kinds of effects with increasing heat. So, and I'm sorry, the Mike Jarrett study was also looking at the fact that COVID is clustering in those same areas that we're seeing the worst air pollution as well. And I'm not saying building a lot of parks would be a wonderful solution, because it gets cooler, kids play more, people socialize. You got to police and manage them, but they have to be. People need them for the feeling of a community. Anybody want to comment, Georges?
Sure, I can take it on. You're right. It's about 9 degrees hotter in the urban setting in these communities, and it's because of the disinvestment. It's the lack of green space. It's also the preponderance of dark space. So let me give a shout out to Smart Surfaces. If you know, we're part of a coalition called the Smart Surfaces Coalition that's looking at lightening up things and trying to do that in a way that makes those urban communities much cooler. And you can do that. We resurface our streets, each and every year. We're all irritated by it because it always results in traffic jams for those of us who are still driving. And the challenge is that you don't have to do that. You can put really more porous surfaces. You can lighten up the roofs. You can put a lot more trees and a lot more green space. And by the way, I grew up in Chicago, as you know, and that just means reinvesting in the existing infrastructure so that those parks look as plush and as green in the hood as they do in the suburbs.
Dick, could I add to that?
Please do.
So I really think there are a number of key points to amplify on what has already been said. One is that climate change is such an urgent problem. We need action at multiple levels. And there's lots that can be done at the local level, which is what George's is focusing on, the local level, the state level, and the national level as well as international. So it's not one versus the other. And this should be an all hands on deck moment with all of those acting. And that provides opportunities for people in the public health community, the biomedical community, the medical providers to be active at multiple levels. And it's not just at the national level or the international level that counts. The local level can have huge impact. And we're seeing some communities address climate change issues much more effectively than others. And so this multiple levels of action, I think, is a point that's really worth teasing out. There are just so many opportunities.
The experience on the West Coast, and all of us on the West Coast have been under a lot of smoke for a long time. You don't need to convince people that things are very different from what they were 20 and 30 years ago. And how rapidly it's happening. I will tell you that San Francisco Bay Area is now as hot as Los Angeles was 40, 50 years ago, and LA is as hot as Ensenada and the Baja. And the water supplies to the cities in the Southwest, if you look at the bathtub ring in the Colorado River, Lake Powell and others, and by that I mean just the decline in water resources, both fossil water underground, but also surface water, we're in for very big adjustments in life. As we go a little further, I'm going to talk about some of the conclusions of Interest Group 19 yesterday, because we had excellent presentations from both Jonathan Patz and Stephen Panonka. But I think, the other part of that leadership thing, though, is, and there was not much enthusiasm about a carbon tax at that session, feeling that we need to be much more aggressive and carbon tax is too soft an approach. But politically, that's what California has done for the last 10 years or so. And about a third of all that money goes to poor communities, at-risk communities. Anybody want to comment on that? And then I'm going to talk about yesterday for just a little bit.
Yeah, let me just talk about where the money needs to go. I think myth number one, we need to stop allowing this equivalency between jobs and the climate. We have to recognize the fact that there is not an equivalency there. From a health perspective, improving our health far outside, reduces the cost of and pays for these kinds of transformations. And so that's the first thing. I think the other thing we have to do is recognize the poverty tax that we put on these communities by not acknowledging the fact that they're at extraordinary risk. And we need to stop giving them the pennies, and we need to start giving them the dollars. And we need to start reinvesting in those communities as a first option. They say pay yourself first. Well, we need to repay these communities first, because these communities have not contributed to their plight in any kind of meaningful way. Until we have a system with everyone in and nobody out, and equity around climate improvements, we're not going to, I think, succeed as a society.
Georges, as I was going to Jackie's bio, the word justice came up about 6 times. And do you want to reflect on that, Jackie? And then I'll go to Sir Andrew, because I'd like to hear from you as well.
Yeah, thank you. So certainly echoing and affirming the need for where revenues need to go And going to the critique of the carbon tax model, many of the EJ communities really talk about the twin challenges. One is definitely needing to be a lot more aggressive, and two is the notion of legitimizing in some ways practices that are literally killing people. It's like, so it'd be kind of having someone pay a tax on murder. So it really, in some ways, that's a lot of the framing that comes out of the challenge with the carbon tax framing. And then just the fact that markets have never been particularly kind to frontline communities. And so that as a market-based mechanism has not been effective. And then just some of the practicalities around if it's more expensive to operate, but yet these companies want to continue operating, they're going to increase operations in places where it's cheaper to operate. And those, of course, would be our community. So concern around hotspots and so forth. So really calling for more of regulations and penalties than encouraging a market around carbon and people being able to pay to pollute is more of that, both the practicality and the framing that EJ communities are pushing for.
Sir Andrew, before I jump to you, I just will mention that the earlier interest group yesterday morning was on the issue of justice, and one of the slides that was shown by a participant was how the death rate for so-called essential workers in the United States related to COVID. And these were people earning between $10 and $15 an hour, working in very, very difficult jobs, meatpacking plants and supply chains, supermarkets, and other big warehouses and such. So the people that were called essential were paid as if they were unessential, and have been suffering so much from this. And it ties to the justice around climate as well. But Sir Andrew, I'm sure you have some thoughts on this one.
Yeah, I think there's a lot of momentum at the moment behind the concept of the just transition. So as we move towards a zero carbon economy, it has to be a just transition. And that means that inevitably those who've been responsible for higher per capita greenhouse gas emissions will have to pay more in order to help decarbonize the economy. We also need to bear in mind that many of those people who've had their jobs in the fossil fuel industries, those jobs need to be replaced by jobs in the renewable energy industry. And we know that per $1 million, you get pretty well 3 times as many jobs in the renewable energy industry as you do in the fossil fuel industries. So we need to emphasize in moving away from burning fossil fuels, the need for increased, obviously, employment, more equitable employment, and also the just transition, which implies that those who've really contributed very little to greenhouse gas emissions should be on the receiving end of some of the benefits of the decarbonization of the zero carbon economy. It's proved very difficult actually to implement carbon taxes and carbon pricing, as I mentioned in my brief presentation. But one of the challenges, of course, is that many people have made a very good living out of not paying the full economic costs of their activities. And so they don't want to move rapidly to a zero carbon economy. So there is a sort of political economy position, a point about vested interests, as we know. But it means that we do have to target and to tailor our policies to address multiple priorities at the same time. More equity, decarbonization, and having a vision of the kind of society in which people live, in which is a more sustainable society, much lower environmental footprints, but much improved health and well-being.
Steve Bacala, who was speaking yesterday, talked about the political problems of dealing with the coal industry in the United States and how President Trump picked up that banner and said, oh, we're not going to get rid of coal. I'm going to bring jobs back. And he was making the argument that and he showed a graph that at this point, because of much more efficient solar and very efficient wind turbines that now, he used the term 100,000 megawatt wind turbines, which I didn't know existed, that it is so much cheaper than coal that the market is just going to move away from coal, whether people like it or not. And he said, one solution is, the coal industry flattened all the beautiful mountains in West Virginia and Appalachia. filled up the creek beds there. And he said that's where we need to put lots of people to work putting in the wind turbines with good, clean energy. And of course, we have to put in the grid that connects that energy from the areas that have a lot of wind to areas that are big electricity consumers. But he sees no viability with coal going forward, and very soon, probably oil and gas, oil quicker than gas, being non-competitive. Natural gas can be turned into hydrogen, and that is still going to be very competitive in the economy. So he actually 15 years ago painted a very bleak picture about what we could do by 2050, and now he's painting quite a positive picture of net zero by 2040. So it was very illuminating. It's going to mean a lot of life adjustments because, to teach a coal miner to build a wind turbine, I don't mean that in a flippant way. It's a very different set of, and both are somewhat scary skills that will require a lot of learning and teaching. Anybody want to comment on that?
Just that I don't think it's such a big leap, to do this. I mean, these are pretty smart people that
right.
Have worked hard for years, and I think you just need to put those plants in those communities and properly train folks and pay them to go back to learning that skill. The fact that we have not invested in those communities has an economic price, it has a political price, and we just have to do that. And then we have to get ahead of, as you pointed out, the demise of the fossil fuel industry. We need to think about how we do a appropriate transformation of those jobs as well. And by the way, those industries ought to be paying for it.
Well, and those workers need to be supported. They've got families, and you just can't send them to school like, younger people aren't paid to go to school. They need to have real salaries and productivity in that process. I got 5 conclusions from the meeting yesterday. I'm going to try one and see how the folks here would present. One of the things I got out of it was that young physicians, nurses, and health professionals are passionate about climate threats, and they want the senior leaders, physicians, managers of the hospital systems, and scientists to actually catch up to them, the young people. And we've certainly seen that with Greta and other such issues. Any thoughts about, Sir Andrew, you're probably the best one for this one, about medical training and how we need to be transforming that? And medical nursing, et cetera, healthcare training.
You're right, Dick. I mean, there's a tremendous appetite amongst younger colleagues, really, for engagement in climate change and these broader environmental issues, which they see very much as part of their health agenda. And whether they be clinicians or public health professionals, they see themselves, many of them, as having an active role in addressing the climate threat, both through adapting to climate change, but also through decarbonising their own health facilities. So we're seeing a lot of activity, which I think is very, very positive and gives a lot of grounds for optimism. And I think what we need to do is to create a global health professionals movement. Indeed, that's already happening through the Global Climate and Health Alliance, for example, the work of Jenny Miller and her colleagues coordinating health professional groups around the world, making the case for rapid decarbonisation of the health system and the role of health in general in advocating for a low carbon economy. So we're seeing a lot of very dynamic change. I would say often the medical schools and the public health schools are a little bit behind the curve. And so they're often not offering the kind of courses that a lot of younger colleagues want to see. And I think one of the problems there is that many of the faculty don't have the skills to offer those kind of courses. So we need to reconceptualize public health. It's not just about the traditional public health disciplines. It's actually working across with a range of disciplines. So I'm starting to work with people that I never did 10 years ago. So climatologists, urban planners, agricultural scientists, obviously social scientists, a range of different disciplines. And we need to think of public health and planetary health as a kind of intersectoral, transdisciplinary endeavor. And we need to break out of our disciplinary silos, really, and embrace this new way of working with our colleagues. I think it's very exciting. We're all learning a great deal from each other, but it is a very different way of operating than the kind of narrow silos in which many of us were brought up.
And I've seen so many of the young people who are afraid of becoming too narrow. They really are energized by the breadth of what we're talking about.
Absolutely. I think we all know that, super specialists are needed, but you also need people with generic knowledge who can cut across a whole range of different problems and see where the common solutions lie. And I think increasingly we should be developing this new cadre of health professionals who may decide to specialize, but at the same time also develop this generalist transdisciplinary knowledge.
I want to assert one more thing, and George, you've thought a lot about this one, but in public health, we have spent a lot of time figuring out how to disincentivize things that are unhealthy, tobacco, alcohol, incentivize things that are healthy, seat belts, the fruits and vegetables in our diet, and other such issues. But tax policy has been very important in this. By the way, the tax policy for sugar-sweetened beverages has worked pretty well in Berkeley, and I'd love to see it extend to California and more broadly. The money's being used for education in schools. And by the way, there's been no decrease in small business sales. People just shift to water because the sugar-laden drinks are there. But I'm very concerned about the level of subsidy that we give to the fossil fuel industry, that we give to the sugar industry, that we give to the corn ethanol industry, that basically is part of the reason we're destroying the Gulf of Mexico. What's the stuff that's coming down the Mississippi from the herbicides and fertilizers and such. And so anybody want to comment on how we can subsidize what's healthy and less about what is unhealthy? And then I have questions from the attendees. So who's going to comment on that one, please?
Well, just a quick response from me, Dick. I think we've got to learn the lessons of when people have successfully withdrawn subsidies and how they've done that. So there's a few nice examples of that. Indonesia, for example, was a country that had quite a lot of fossil fuel subsidies, and they were able to withdraw some of those when fuel prices were low. And what they did was to recycle it into universal health coverage. So what they did was actually provide something that people on all incomes, but particularly low incomes, wanted. And that made it much more palatable to their population, to their community. So we need to think about intelligent ways of recycling subsidies so that people don't feel they're being deprived of something, but they're gaining something else which is even more important to them. And that's an important lesson to how we design, I think, subsidy withdrawal and if we're going to do it, carbon pricing.
I have a question that came in from Jill. I won't say much more, but and maybe Sir Andrew and Georges could comment. Well, we're very concerned about the poorest communities in the United States. In the poorest countries, such as Niger and Burkina Faso, the impacts of U.S. actions have, and by the way, the carbon emissions from the U.S. have been tremendous in these areas. Any thoughts about how we could have an impact internationally for these burdened and challenged countries?
Yeah, we have to walk the talk in our foreign policy efforts. We're concerned about the impact of our carbon footprint here, then we need to make sure that we carry that through our treaty obligations. That means we have to, pay up our treaty obligations too. As you know, we are often one of the groups that does not pay all of our dues. We still owe WHO money. As an example. So I think, we do contribute obviously a lot to international development, et cetera, but a lot of times our policies are in variance to what we think. Tobacco policy is an excellent example here, right?
Sugar as well.
Yeah, our tobacco policy globally does not mirror our behavior here in the United States.
When you get to know a general, one of the things they say is they're the biggest supporters of diplomacy. And the general then says, we'd much rather have you guys talking than have our people fighting. And I think the reconstitution, the morale in the State Department's been terrible. And by the way, the morale at CDC has been terrible. And they've gone from 90% of average Americans thinking CDC very, very highly down to 17% just in the last 2 years. So reconstituting the morale, the infrastructure, the competence, valuing people that are dedicated to service is, in my opinion, going to be so important. And over my career, I've been so impressed with people in the State Department that I've dealt with. Not necessarily the ambassadors, but the actual people on the ground. I'm speaking respectfully. Somebody laughed, but go ahead.
Well, you know, we need to make sure that we begin to put people in those jobs that are trained and competent. You know, I mean, having a health department without somebody who is actually a health professional doesn't make a lot of sense. Although I would love to be the Attorney General. I suspect I'm not qualified for that job.
I'd make you Surgeon General.
No. I got a job. But I do think that we have to do that. I do think we have to be thinking about what we want in those jobs, the expertise, and these jobs are leadership jobs. You know, you need people that are good leaders, and we have them in the health sector. You know, we have lots of leaders, and they often don't get those jobs. And I think we have to make sure that happens this time.
I have a question here who a person was writing and saying that the degree that environmental health is actually taught in clinical practice is extremely small. Yes, they talk about seatbelts and helmets and what to eat, but we're not doing a good job with medical education. You kind of touched on this, Georges, but the question came up again. And Chris Castle, who has been influencing many of the medical schools and a long-term member of the academy, said to me one day how hard it is to influence curriculum in medical schools and other settings. You're not surprised by that, right, George?
No, not at all. Not at all. You know, changing even adding a course in a medical school curriculum is a Herculean task. But and I know medical schools have begun to rethink how they're doing this. But we've got to move much more prevention and wellness as a core component of medical education, also nursing education, I might add. We have to do a much better job of teaching folks to work across silos. You know, medicine has historically been taught as an individual scholarship, a level of scholarship. It needs to be really more taught as a team sport. And team scholarship, I believe, in terms of rethinking about how we do this. We're going to be learning in teams more and more. We're going to be depending on teams more and more. The amount of knowledge that an individual clinician has to know right now far exceeds most people, unless you have an idyllic memory. And Dr. Google is a great tool, but as you know, medicine is an art and a science. And increasingly, how to do that and do that in a way that's a team. And by the way, across disciplines, and not just medicine, but I think as Andy talked about, we've got to work with urban planners and meteorologists and others that bring a degree of expertise and thinking about the problem very differently than I was taught in medical school.
So I completely agree. In order to get that teaching done, I'm going to make a outrageous suggestion, which is the NIH's budget for the last 15 years has been approximately $40 billion a year, inflation adjusted. That's $600 billion. And so if you calculate how much support has been given to many individual diseases and other disorders and affected groups, and then you want to know how much was given to climate change and health, it comes out to, no exaggeration, 0.05%. So virtually nothing. And we're never going to get those courses taught unless there are people who are trained and within the medical centers and know there's a grant. And you're not going to convince a young medical student or a PhD or anyone else to look at climate change and health in great depth unless there is a pipeline of support. And I think NIH probably, this is my opinion, needs to institute a brand new center called the National Institute of Climate and Health, because We're never going to turn this around in the medical world until there is a pipeline of funding. And somebody said, well, what would you have them do? And I'd say I'd hire 20 really smart people and have them look at the issues and come back in 2 years and tell us, here are the things we need to do. Because none of us should be doing this off the top of our head. But this situation right now is unacceptable. Andy, that's a pretty provocative thing I've said, but I'd be interested to hear what you think.
Well, I mean, it sounds a good idea to me. Great. It's music to my ears. But I also think that one needs to include climate change across a range of disciplines. So I'd like to see cardiologists talking about the effects of climate change on the cardiovascular system, or nephrologists talking about the threats that climate change brings to renal function, the family physicians talking about the impacts of climate change on environmental health on their patients. So yes, we do need dedicated courses and dedicated institutions, but we also need to mainstream, I know it's a horrible word, but that we need to actually ensure that climate change and global environmental change more generally is a kind of cross-cutting theme across the whole medical and nursing agenda.
So I'm going to push back slightly. The comment was made that people talk about, we're going to work on diversity, we're going to work on more women, and nothing happens until there's actually a person of color or a woman in the boardroom, and suddenly the evident absence of allocation of funds and support becomes, you can't wave your hands about it. So I think we're going to have to create this pipeline. It's not going to happen otherwise. Let me look at one more question.
Dick?
Go ahead, Jane. I'm sorry.
No. So it just struck me that the continuing education track is also one to examine, in part because you said earlier that many of the young healthcare providers are frustrated that their elders aren't where they are. So there's a need for not only reforming medical school curriculum, but also the continuing ed curriculum. And they are sometimes thought of in totally separate buckets. But your National Center for Climate and Health, and perhaps we would add equity, could be a real mechanism for doing both of those, but also bringing in the equity and justice issues that are so intertwined with these others.
Jackie's bio mentioned that she thinks a lot about communicating these issues. And one of the problems, and Georges is going to agree with this, a lot of the continuing education in the health professions is pretty boring. And I think we got to use your slides, Jane, and we've got to really make it something that is irresistible for our fellow healthcare people. And by the way, their lives are very tough. And so anything that can give them a broader scope and a bit more joy and dealing with what they're dealing with, I think is very, very important.
Yeah, I would also, let's get them out of their offices into the hood. I think we need more community-based participatory research. I think we need to, but not the kind of research where they go into those communities and tell those communities what to do, but where they go in and actually write those proposals with the community. And the community, again, doesn't get the pennies, but gets the dollars. And builds lasting infrastructure in those communities. And that's the other thing we need to do overseas, is that we need to make sure that we, again, don't go into those communities with our grand ideas, but we help them build the capacity for their ideas. And then we import those ideas back here to the U.S. because far too often those ideas are really, really good ones. They work quite well, but because they occurred someplace else, we're always afraid or too arrogant to implement them here in the United States. And it turns out they're very good ideas, and they would work quite well in many of our communities.
I'm going to ask the moderators. For some reason, my clock has disappeared on my screen, so I need to know how I'm doing on a countdown right now.
2 minutes.
Somebody just said 2 minutes?
Yeah.
All right, well, that's easy.
5
All right,
minutes.
then. 5. All right, well, do I hear 7? No. I think that amount of time means that each one of us ought to be asked for a sum up and maybe even a big wish that you would have for what needs to happen in the next couple of years. And I've told you mine already, but Sir Andrew, you first.
Well, obviously, my wish is that we accelerate progress towards a zero carbon economy. But I think specifically, I would like to see the health professions really stepping up to the plate and really accelerating progress in terms of decarbonizing the healthcare sector and raising the profile of climate and other environmental changes in healthcare curricula. So that's a really important, I think, objective for the next few years. But most importantly, health professions need to play a leadership role in urging for a just transition to a zero carbon economy, which will be good for our health and good for the planet.
Wonderful. Dr. Lubchenco.
So I think one of the most important things that people can do is to talk about climate change and the connections to health in this instance. Far too often, it's sort of somebody else's problem, and even if I'm concerned about it and I don't talk about it, then others don't know that I'm concerned. And the opportunity to become informed, to share information, there are so many good places to get that information now. But I think for the people that are in the audience today, talking about healthcare and climate connections is one of the most important things that can start the ball rolling and then lead to some of the policy changes that are urgently needed. But communicating it, talking about it, thinking, okay, what can we do? What are the actions that flow from the knowledge that we have? But sharing that, not just saying, okay, somebody else is going to do that.
And I should mention that Dr. Zhao will talk in the next hour about the agenda going forward with Judith Roden and the folks that have thought about this. I did not mention, but Gary Cohn has done wonderful leadership in healthcare without harm and green healthcare. And I also really moving hospitals to the healthcare system. And a speaker yesterday said, well, you know, the healthcare system's not that important. We should do the overall. And I think, in fact, we have no business telling other people what to do unless we've cleaned up our own house. And that's true for medicine. It's true for the United States of America. And politically, you often hear some politicians saying, well, we're not going to clean up because so-and-so is not doing it. Well, that's not leadership. That's what we need to go ahead and do. Jackie, I'm going to ask you next, please. Come off mute. Thank you.
So I think we need to recognize that the social determinants of health are the same social, political, and economic determinants of climate change. And that rests in the way our society has been structured, as I said, as it relates to exploitation and extraction and so forth. And that in order to address health and in order to address climate change and the drivers of the ills of society, we need systemic transformation. So whether we recognize that socially racism is a determinant of health and it's a determinant of climate change. That the xenophobia is a social determinant of health and climate change. That all the different ways that we're interacting with humans and with the earth is determining where we are in terms of health disparities and the proliferation of climate change. And therefore, we have to think about and act on root causes and systems transformation. So it's a deep charge and mandate, but without it, we're going to always end up in the same place that we were. We saw it with COVID-19, we saw it with Hurricane Katrina, and we see it with the continued unfettered emissions of greenhouse gas emissions, and it will continue unless we actually get to the root. Thank you.
Thank you. Georges.
You know, all I can say is that climate change is here. It's impacting our health today. And if I had a wish, I would ask all of the members of the Academy and probably anyone in health who's listening to this broadcast to please add climate change to the portfolio of things that you're going to be doing in the next few years. If we don't do that, we'll be destined to failure. This needs to be a top priority for all of us in health.
I have two closing thoughts, if I may put them forward at this point. Every technology in the history of the world, every major social change impacts human health. Think about the car, the airplane, even the internet. Human health is impacted. There are people talking about geoengineering and maybe sulfur aerosols in the atmosphere to help cool the planet. All those interventions will have health impacts. And I think the old way we have thought about environmental impacts, the environmental impact assessment, was really inadequate. And at one point in my life, I read quite a few of them, and there'd be 997 pages of, frankly, boilerplate that was done by consultants saying, this won't happen, that won't happen, we won't violate noise standards, won't violate dust standards, etc. But there was no genuine assessment of impacts on human health. And George, as you know, you come out of emergency medicine when a person is confronted with a very difficult decision, and let's say it's a cancer diagnosis. You have the options of doing nothing, chemotherapy, radiation, surgery, and people have to look at how do I optimize, how do I get the most benefit. But I don't think when we look at environmental decisions, whether it's high-speed rail or fixing up the grid or electrifying, moving entirely to an electric-based economy rather than a fossil fuel economy, we need to really look at and count the health benefits. And that's why some of the work that John Patz has done, and you showed some of those slides, in quantifying the health benefits, but nothing's going to come without health risks. People will be killed putting in those high voltage wind turbines. Hopefully not, but it's very hard. That's not necessarily easy work in the wintertime with the wind blowing. So we need to really do a much more thorough health impact assessment. And I think as we reinvent America, and this is the other one I want to close with a little bit here, is the old normal, what it was back in, even under the Obama administration, the old normal was in fact abnormal. There have been immense transfer of wealth from the middle class and the poor people in our country since about 1980. It's made life extremely difficult for many, many people, particularly persons of color, victims of discrimination, people whose jobs have moved overseas. And we have to figure out ways that we can make a healthy, safe, more prosperous, and largely non-polluting environment. And I think one that's culturally welcoming too, that being in a diverse and enjoyable place adds to our mental health, our social health. Having green space where our children can operate. Every child in America ought to be able to walk or bicycle safely to school, at least in the urban area, and every child ought to be within a quarter mile, and every elderly person ought to be in a quarter mile within a park. We need to stop penalizing people that don't drive, because 1/3 of Americans don't drive, and yet they're the most immobilized, in many senses, the word, people in our society. And they're often immobilized because they're either too poor or disabled or too old or too young to drive. And so really thinking about an environment that welcomes physical activity, welcomes socialization, and enables us to eat healthy food that's locally grown I think that's the normal we want to get back to, not the same nonsense that we were at before. And that's my own opinion. But any other quick comments? I'm trying to read some of the ones from the audience attendees, and I haven't. Some of them are so big, like list all the mitigation measures you want to do, and I'm not about to do it. I see Dr. Zhao there, so.
Let's join you and everybody else to give a great round of applause for this group.
It's a great group.
Give the applause.